Okay, hello, my name is Felicia Cordelia Ruslim, and my NIM is 2453669 3KU25878. And here I am going to be presenting my presentation regarding the second meeting of Scenario 3, Block 1.8. So this scenario is basically talking about adolescence and growth. Okay, first of all, we're talking about the factors influencing normal adolescence growth and development. So here I am dividing the factors into three, which is the biological development, the psychosexual development, and also the social development. So first of all, for biological, or also in the sense where it's correlated with physical development, definitely if we talk about adolescence, we're gonna think about hormones. But then how do these hormones appear? So these hormones actually appear because there's the activation of the HPA axis. And so by this activation, there will be somatic growth, sexual maturation, and brain remodeling, particularly in the prefrontal cortex, which is the part of the brain that affects judgment and impulse control. So basically, this is where the children can actually transition from having spontaneous thoughts and also less impulse control. And when they are growing to become adolescents, as their prefrontal cortex is actually developing, then their judgment and impulse control will become better. Next is the psychosexual development, where there will be an exploration about sexual identity, orientation, and intimate relationships. And this will occur alongside neurocognitive changes. So, of course, during adolescence, it's also a very critical time for self developing and also for exploring themselves. In here, they will start to identify what is their sexual identity, what is their sexual orientation, and also how their intimate relationships are gonna occur throughout their adolescent life. Next is social development. So here we can see that actually for adolescents, especially in today's age, there's a lot of them who are FOMO, or like fear of missing out. And this is also related because the influence of the peers, of social media, of culture is actually going to affect them. And also the family, their environments are definitely going to be very huge factors that may affect their social development. Here they will start to find their independent identity. Like they're gonna start searching which culture, like which aspects of their peers, their social media, their family that are actually corresponding to themselves. And the next is communication in adolescents' health issue. So, a common problem found in adolescents, especially perhaps in the medical field, is that they rarely would like to open up if their parents are there. So here we should address this issue by giving them an opportunity to be independently seen, such as perhaps talking with them without their parents first. And then we can also explain and ensure their confidentiality, because by doing so, will they actually start to trust us and open up to us and be truthful? Because of course, in the medical field, the truth of like what they experience is much more important. Like it's the most important thing for anamnesis, for history taking, and more. However, again, confidentiality can be broken because, after all, they are not adults yet, and so this confidentiality can be broken when there's a serious risk of harm. However, actually, in some cases, like in several parts of the world, several adolescents may give consent. Like they don't need their parents to give consent. Like they themselves can give their own informed consent. However, if they're only sufficiently informed and competent to make decisions. Again, this differ from country to country. And then also perhaps one big conflict that can occur from this issue is that there will be a conflict between the patient's interest, the doctor's interest, and the parent's interest. So here, doctors are supposed to arise to handle the disagreements over consent, because oftentimes there may be sometimes when the parents want to do one thing and then the patient doesn't want it, and then the doctors also like have another perspective of this, and then in this case the doctors are supposed to be able to accommodate like the discussion, become like the mediator, so that we can cooperate to give the best treatment that is necessary for the patient, which is an adolescent in this case. Next is the health promotion and disease prevention, and also the consequences. So here we have first sexual and reproductive health. One of the major factors that are occurring in regards to health promotion and disease for adolescents is definitely related to sex, because nowadays there are a lot of teenagers or adolescents also, as well, who are already like actively taking sexual actions. And here we need to remind them of the importance of contraception, how teenage pregnancy or basically underage pregnancy is actually harmful for their health. And however, we can also talk about gender identity and sexual orientation, where again, like what I stated previously, with how they are starting to search for their identity and their place in the society, they will start to figure out what is their gender identity and what is their sexual orientation. And then regarding to contraception, also about STIs or sexually transmitted infection. And here, there is also a need to give education about why contraception, uh, I'm sorry, of why a safe sex is actually necessary, like using um, a condom or other methods of contraception that can prevent STIs. And then, of course, again, adolescents, especially for women, there's gonna be menstruation, and here we need to educate them about the hygiene, about about how menstruation is actually something that's normal, and how to identify whether there's a problem with their menstrual cycle or not, because that is definitely related to their reproductive health. And yeah, those are several aspects that we can consider for sexual and reproductive health. Next is psychological and behavioral health. So nowadays, in today's time, there's a very high cases of depression, anxiety, non-suicidal self-harm, and suicidal intention in teenagers or adolescents. Here, they also start to have eating disorders, usually due to um, one of the examples is that due to the beauty standards of today, which relates to being skinny, and several of them developing the eating disorders because of trying to fit in with these standards. And also perhaps one that is um quite often to be seen, especially perhaps like outside of Indonesia, is substance use. But then again, in Indonesia, there's also a very high cigarette consumption in within adolescents, which needs to be taken into consideration as well, so that we can like ensure that their psychological and behavioral health can develop how it should be as for adolescents. And the next is nutritional problems. Again, obesity, undernutrition, and other diet related conditions, where perhaps obesity is now one of the types of diseases with the most cases, not only in adolescents, but basically in the general population. So yeah, they can with how they are still developing for adolescents, everything that's related to nutrition can actually affect them in their later lives, whether in adulthood or even in their elderly lives. So here we need to actually take action for their nutritional problems, so that they can at least stay within a normal normal range, so that in the future, for like a sustainability of healthy of a much better and less risk of developing unwanted diseases or illnesses. Next is safety and violence. Again, because although I stated that the prefrontal cortex is going to be developed, there's still, of course, a process to it. And here we'll still see some impulses for adolescents, because sometimes they also like to search for adrenaline rush and such. And here there will be several problems for safety and violence, where they start to get injured, whether through traffic injuries, through violence, assault, and also bullying. Okay, and next is transition to adult. So first of all, we need to identify the difference between child, adolescent, and adult. For child, it's basically birth until 19 years old. Adolescent is 10 until 19 years old, and adult is basically above 19 years old. This is based on the WHO. And then what is aging? So aging is basically, for in medical terms, we also say it as senescence, which is the aging of the cells, and this begins at the end of puberty. And it's actually a gradual and progressive decline which affects this physiological function of organ systems. And the holistic effects of all genetics, lifestyle, and environment, they will manifest as increased risk for chronic diseases. And the central medical task for doctors is now to become disease prevention, management of chronic conditions, and also functional preservation. So there are several theories about talking about transition from children to adults, and two of them, which is most famous, is Erickson's psychosocial theory and Freud's psychosexual theory. First of all, for Erickson's psychosocial theory, we have 8 steps. First is trust versus mistrust, which is from birth until 18 months, and then autonomy versus shape and doubt for 2 until 3 years old, and then initiative and guilty in 3 and 5-year-olds, and then industry versus inferiority, which is 6 until 11 years old, identity versus role confusion in 12 until 18 years old, intimacy versus isolation for 19 until 40 years old, generativity versus stagnation in 40 until 65 years old, and last is integrity versus despair, which is 65 years old until death. So for Erickson's psychosocial theory, he actually stated that if one process, for example, trust versus mistrust, is not done, like is not finished completely, like perfectly, then it will cause an effect to the other transitions of life. So if trust versus mistrust is actually not like perfectly ended, then it will definitely affect for autonomy versus shape and doubt, initiative versus guilty, and all until ego, integrity versus despair. So it's basically saying that the psychosocial progression of like learning for a human starting from their birth until their death, it should be completed as perfect as possible so that they can transition to all stages of life in the most ideal way. Next is Freud's psychosexual theory. First of all, is the oral phase, which is birth until 1 years old, anal phase, which is 18 months until 3 years old, phallic phase, which is 3 until 6 years old, latent phase, which is 6 years old until puberty, and last is genital phase for puberty until adulthood. Okay, next is the preparation for adolescence. So first of all, maybe the most one of the things that we need to think about is regarding the health service. So for adolescents, we need a more holistic and comprehensive health service for them. Here are the 7 things that are necessary for this comprehensive and holistic health service. First of all, is promoting mental health and well-being. Second is improving access to nutritious and healthy food. Third is promoting physical activities and active communities. Fourth is improving health-seeking behavior. Fifth is promoting safe environment. Sixth is reducing the use and minimizing harm from substance abuse. And the seventh is promoting sexual and reproductive health. However, there's actually a problem for the preparation for adolescents, especially in the health service. So adolescents actually are falling awkwardly between pediatrician versus adult physician because they're neither a child nor are they an adult. So, actually, only several places in the world have this subspecialty for adolescent medicine. And this is still something that's lacking in Indonesia today. However, perhaps what's already getting better is the facilities for adolescents, where there are rooms and also beds that are already like sized according to them, and also because adolescents are sensitive towards like privacy, then it's also like already considered for the facilities like so that um they have more they have so that they have more privacy. And then last is the consequences in adulthood of ineffective, delayed, or unsuccessful transition. So there are actually several effects as to what are the consequences if actually the growth of a child to an adolescent to an adult is actually like ineffective or delayed or unsuccessful. And they are mainly divided into 3. First of all is the exacerbation of health disparities, particularly for the vulnerable populations. Second of all is poor disease control and increased complications for those with chronic conditions. And lastly, it is the disengagement from healthcare systems, leading to fragmented care, missed preventative services, and poorer long-term health outcomes in adulthood. So that's all for this scenario 3, second meeting of Block 1.8. And that is all from me. Thank you for listening.